Hi, I'm Dr. Yu. I'm a facial plastic surgeon here in Beverly Hills. I hope everyone's been enjoying a happy and healthy 2017. A lot of my patients and many of my viewers have asked me to talk about Botox for masseter reduction, also known as the V-line procedure. It's called the V-line procedure because the goal of the procedure in terms of the cosmetic effect is to create a more tapered, slim appearance of the jawline akin to a V. The way that it works is it relies on Botox to relax the masseter muscle. Botox is a neuromodulator, but that's really a fancy way of saying it's something that creates relaxation of the target muscle. And so in the case of Botox for masseter reduction, the target muscle is the masseter muscle. It's a rectangular shaped muscle that sits on the side of the jaw on both sides, one of 4 muscles involved in chewing, and that muscle gives volume and fullness to the sides and the angles of the mandible and the sides of the jaw. By relaxing that muscle, the volume of the muscle decreases. Just like any other muscle in your body, when it's relaxed with Botox, it's unable to work out, and especially in cases of hypertrophic or enlarged muscles, that masseter muscle will atrophy and shrink down in size over time. Slimming effect usually takes about 4 to 6 weeks to notice, and the effect of the Botox will be present for 3 to 4 months. And so for about 4 to 6 months, that Botox will work, and it will work to slim down the jawline and create a more tapered appearance. It also has a secondary effect of reducing the tightness in the jaw and reducing TMJ associated pain, bruxism or grinding of the teeth, and general strain in the jaw because of grinding and teeth clenching. The way that it works is because the masseter muscle is one of 4 muscles involved in chewing, the overall strength of mastication or the bite will be reduced. Is that enough to reduce your eating or chewing? Absolutely not. So you're not going to notice a big difference in day-to-day eating, chewing, or swallowing, but if you eat a big chewing intensive meal like a 22-ounce steak, then towards the end of it, you will feel a little bit fatigued. That's a normal sensation to have even without any treatment of your masseters. When you eat a lot or chew excessively, you will feel this soreness and fatigue. With Botox for masseter reduction, you'll feel that a little bit sooner. The other side effects that are possible with Botox for masseter reduction are generally bruising, which can happen with an incidence of about 1%, because even though it's a tiny baby needle, it is a needle that's used to perform the treatment, and it can leave a pinpoint bruise at the site of injection. The other thing is that it can feel temporarily sore for a couple of hours up to a few days through the injection site in the muscle, because the needle does pass through the body of the muscle, and the masseter is a fairly thick, bulky muscle. Those are the primary side effects. It's important to seek out a board-certified facial plastic surgeon who's experienced in Botox for masseter reduction, because in the hands of someone who lacks experience, it can be a far riskier procedure and can result in changes to your smile, even to your speech, and asymmetry of your face. A lot of patients also ask me, will it cause sagging of the skin or jowling? And the answer to that is no, it absolutely will not, because the Botox works only on the muscle. What it will do is it will reduce the volume of the muscle and cause the jawline to be more tapered. Sometimes it can accentuate the junction between the cheekbone and the cheek, creating more definition of the cheekbone and creating a more defined appearance, but it will not have any effect in terms of increasing or decreasing the amount of skin elasticity, the amount of skin relaxation, or drooping. So while Botox for masseter reduction certainly will change your facial appearance, it will not cause skin to sag or droop. A lot of patients also ask me, is this something that will last permanently? The answer to that also is no. It's a temporary treatment. It will last on average 4 to 6 months. If you do nothing, then on average in 6 months, appearance and the function of your muscle will return to exactly how it was pre-treatment. With repeated or serial treatments every 4 to 6 months, it is possible to shrink the muscle and atrophy it to the point where the duration of the effect will be longer. However, that comes with serial treatments, and at any point if they are stopped, then the muscle will regain its original strength and the original appearance will return. So I hope that this was a little bit educational and informative Certainly, if there are any other questions that you have, or if you'd like to know more about the procedure, feel free to contact me or my office, and I look forward to speaking to you soon.